It's a reality of the now 2-year-old pandemic. African Americans have been hit harder by the virus than many other ethnic groups in the U.S.
I want to see my grandchildren and hug and kiss them, and I can't, because of my health situation.
While vaccines have helped, blacks have been hospitalized with COVID-19 at 2.5 times the national rate of whites and died at 1.7 times the rate, according to the U.S. Centers for Disease Control, highlighting a disparity in racial health that's existed for years.
I think it's been ignored, and when COVID came around, it kind of pulled the Band-Aid off of all these issues and made them much more visible to everybody.
Dr. Reggie Washington, Chief Medical Officer at Rocky Mountain Hospital for Children, says there are a host of explanations for historically subpar black health outcomes. A genetic predisposition to certain diseases, lack of proximity to doctors, pharmacies, and good quality food, lack of transportation and places to safely exercise, and preventive care and personal responsibility that are too often lacking.
If you have those things, you're not going to do as well. It just so happens more African Americans fit into those buckets than other racial groups.
We kind of had a rocky foundation already, and then the pandemic just kind of took it over the top.
Dr. TERRI Richardson works with an organization dedicated to achieving health equity in the black community.
We go out into barbershops and salons, and when people's blood pressure is high, we ask, do you have a doctor? And many times they'll say yes, but have they been in? No.
There's long been black mistrust of a medical profession that often doesn't look like them.
I've had people say, the doctor wouldn't look me in the eye. Those things do impact people's willingness to access the healthcare system.
Shining a spotlight on this complex problem, as has happened during the pandemic, is one thing. Implementing solutions, both doctors say, is something else.
If anything, the problem's getting worse rather than better.
Washington says educating new black doctors and nurses and educating black patients to take their health more seriously are both needed. More clinics in African American communities wouldn't hurt either.
It's going to take planning, money, resources. People have to really want to make this better.
I think people are becoming more aware of how they can contribute to healthiness.
Richardson sees glimmers of hope, but says systemic changes in U.S. healthcare are needed.
It means looking at your whole setup. Is it welcoming for a diversity of people?
Like a bad asthma attack, she says,
as long as it took you to get there, it's going to take that long for you to get out of it.
When it comes to black health, a lot of work lies ahead. HENDRIK, SYBRANDY, CGTN, Denver.